Dr. Al, thank you so much for joining me today on the podcast to talk about your incredible story and kind of, this health journey that you went on that kind of propelled you into this whole other world of nutrition and all this craziness. So I appreciate your time.
First of all, I appreciate your time. This is what I love to do. I mean, I'm an old guy. Almost 74 years old. This is fun for me. And it's very revealing. I think it's inspirational. And some people get into a quagmire when they have a very poor healthcare situation going on with them or their loved ones. There are other ways to deal with it, and I'm a case in point.
Yeah, and it's really interesting you say that because I don't think those of us that do what we do, either talking about this kind of alternative, which I don't even really like that word, but alternative health world started somewhere with some sort of illness or some sort of issue that this
Yeah,
alternative health helped us to remedy. So let's just dive right in. Why don't you tell us a little bit about your
my journey.
your yes, yeah.
So, like I said, I'm almost 74 years old. I have a lot of years and a whole bunch of stuff that has happened to me. I was trained as a conventional periodontist. I lived the conventional way that the standard citizen in the United States lived. I ate a standard American diet, nothing healthy at all. Didn't realize I wasn't unhealthy. So at the age of 59, something happened. I had a stroke at the age of 59. And it was not a devastating stroke, but it was a stroke. I couldn't talk and scary. My conventional medical doctors saved my life. They put me on 7 medicines for the rest of my life. And they basically said, eat healthy and exercise. Well, what did that mean? Right. So I didn't know what that meant because I thought I was eating healthy and I thought I was exercising. So I did a lot of research, recovered within 2, 3 months, I was back in practice. So I recovered and started to look into the organizations that you and I probably would say would be the answer. So the American Heart Association, the American Cancer Society, the American Diabetes Association, all these organizations have all kinds of information on their website, how to eat healthy and live a healthy lifestyle. I tried to incorporate all those things and I was pretty good. I mean, when somebody tells you, when you have a life death experience, unless you have a death wish, if you have a life death experience, you probably are going to say, hey, something is going to click in my mind and I need to get motivated to do something. So I did. And I followed everything to the letter. I was at that time, I'm only 5'7". So I weighed about 187 pounds. That's a little chunky. Um, and again, like I said, I was eating a standard American diet with all the junky food. So I started eating healthier and I started changing my ways with exercise, but not a whole lot of difference. And between the age of 59 and 66, that's a long span, um, I lost maybe 4 or 5 pounds, still was on 7 medications, but I thought this is the way it's going to be. I didn't like the idea it was on medications, but it never got any better and I had to stay on them. So at the age of 66, I find a course in nutrition at the Kripalu Center for Yoga and Health. It was for healthcare professionals and it was going to be a summary of nutrition. And I thought this was going to really hone in all this information and it will prove exactly what I'm doing is correct. It's a 5-day intensive course. So I signed up, I went, and it was amazing. First of all, I learned that practically everything I was doing was wrong. That's a mind blowing fact. And I learned, and this is unusual for the Kripalu Center, but there were other instructors there. I learned of the Paleolithic type of diet, and primal lifestyle. So I changed everything. I called my wife, got home after 5 days, called my wife and said, I'd like to make some changes. So when I got home, we bumped heads quite a bit. She did give me permission to make changes for the first 30 days. So I removed everything that was not paleo type foods from the refrigerator, freezer, the cupboard, everything. I had 7 bags of groceries that we took to the food bank. and I also had no food in the house.
I was gonna
So
say, what was
I
left?
it was nothing left. So maybe some ice cubes, but that wasn't even good water. So my wife and I started to shop. I learned organic. I learned farming, going to community farming areas that I could buy fresh pastured meat and pastured eggs, and it was a fascinating experience for me. So I started eating this paleo diet and living a paleo lifestyle with a change in my exercise pattern, basically changes that Mark Sisson promotes with his primal blueprint. So I got into this, and lo and behold, within 2 years, from ages 66 to 68, I lost over 30 pounds, and I got off every one of those 7 medications in 2
Wow.
years. Amazing. So at that point in time, I'm thinking, and you know, I'm not trying to be on a diet. It's just when you eat healthy, your hormones rebalance and all this excess junk disappears.
Yeah, and a
So,
lot of that ends up being inflammation,
oh,
and
of
I mean, it's
course,
not just weight and it's not just fat, it's inflammation in your tissues.
joint health, fatigue goes away. I mean, your skin clears up. It's just a phenomenal process.
Mhm.
So I'm thinking at the age of 66, now I have all these years, only 2 years, but these years of experience, I'm thinking this is a game changer for health. No one knows about this, at least none of my contemporaries, none of
Mhm.
my dental friends knew anything about this. So I am going to start integrating these concepts with my periodontal patients. So I treat periodontal disease. I've been doing it for 44 years until I stopped in 2018. But at that point, at the age of 66, I started explaining to my patients how diet is so critical for the health of the mouth. Now, patients come to me, I'm a conventional periodontist, come to me because they have periodontal disease. They don't want to hear about nutrition. So maybe 5% or less of my patients were interested in what I was saying.
Mhm.
But those 5% that actually got involved with this change in dietary habits and lifestyle changes had significantly improved mouths, much better overall progress of their periodontal health over the years, and a decrease in other chronic illnesses that they had. It was just amazing. Now, I also had patients that would come to me, and I would start talking about this new way of eating, and you know, you could see their eyes roll up a little bit, and they left like after the first examination and told the front desk, I don't want to come back and see him. I want to go to a real periodontist. I don't want to hear about nutrition.
I
Well,
was
you
gonna
know,
say, how brave of you to be able to kind of integrate this into your practice, knowing that people who come to you have certain expectations about what kind of care they're gonna get, and you start talking about food. I'm sure it kind of spun some heads.
I'll give you an interesting story. I don't really talk about this, but it's interesting. There was a mayor of one of the small cities around where I practice that came to me, and he was uh, a marathon runner, and he exercised excessively every day of the week,
Mhm.
and he had severe periodontal disease. And I was telling him we can treat his mouth without a problem. This is what I do. And we were talking about laser treatment and getting his mouth healthy. And I mentioned to him much of this could be caused by reactive oxygen species created by oxidative stress from over exercising. I'm suggesting to him that he may cut back on his daily severe exercise routine, and maybe it would heal his gut a little bit better. We could talk about that. And it would be in conjunction with my treatment for his periodontal disease. He left and never came back to me. I don't even know where he went. He had severe disease, but he told the front desk, this is not the place I want to be. So it's, you know,
Oh.
it's interesting. Some people just get it, most people don't, but that's okay. Anyhow, go ahead.
Right, and I think, you have to kinda meet people where they are. You can't really, if you're not ready to hear those things or incorporate those kinds of changes into your life, it's gonna sound wild. It's gonna sound like this wild, crazy concept. Um, just like the idea of integrative medicine sometimes is
Yeah,
this. I
it
mean,
is.
it makes sense to you and me, but
I
you
had
know,
a sense that this guy actually wanted to hear what I had to say. So I brought this up to him and it just turned him off because I interfered with his running routine, which I guess it was his whole life. And he didn't want to hear that it could be a factor. So he tuned me out and left the office, never saw him again.
wonder where he is now.
I don't know. So anyhow, I'm doing very well, and my patients are doing very well that are accepting this
Yeah.
concept. So here's what happens: I start to become a little bit known. I write a book. I do some lectures to some dental groups and then some other alternative groups. I'm doing virtual consultations actually around the world, and I'm asked to speak at the Paleo FX meeting in Austin, Texas in April 2018. So we're fast forwarding. Now I'm 71 years old
Mhm.
and I am traveling from Charleston, South Carolina to Austin, Texas. I have to go through Atlanta Airport, like, you know, for wherever I want to fly. And so it's a large airport. I love the airport actually, because I usually book my flights so there's enough time between flights so I can walk the concourses. So, and there's a long walk there involved. So I have my bag, whatever bag I pack, I put it on my right shoulder and I walk the concourse. I don't take the train. I walk all these concourses and I feel great. But this time it's a little different. As I'm walking, I'm noticing my right shoulder is starting to feel sore. Never happened before. And so I get to Austin, I do my speech, I go home to Charleston, and that soreness isn't going away. And I'm thinking, I must have pulled a muscle or a rotator cuff, something's going on. So I'm a little pig-headed. I don't do anything. The pain kind of goes back to my shoulder blade. And then it starts to come back in front to my chest, my sternum area. And I'm actually having a little difficulty taking deep breaths. So then I'm thinking, and this is in April, starting in April of 2018. Now it's about August 2018, and I figured I need to see my doc. So I go to my doctor. This is the guy that treated me when I had a stroke, and I've seen him for years, and he's a good buddy and a good friend. And I go to him and I say, look, Billy, I've got this problem. I must have torn a rotator cuff and it's spreading to my chest. I don't know what's going on. So he prods and pokes and he says, yeah, something's wrong. And I said, yeah, that's why I'm here. And I usually see him every year anyhow for an annual. So he says, let's do some basic blood work and see if we can figure out something. So he does a basic CBC, you know, complete blood count, a complete metabolic panel. And so he also includes a CRP, a C-reactive protein. Just try to find maybe if there is any inflammation in my system. Everything comes back relatively in normal range, which is interesting now, except the C-reactive protein. Now, C-reactive protein, if you're a healthy person, should be around 0.5 or less. It was over 5.0. Obviously, something's going on. It does not say if it's an acute infection or it's a chronic infection, doesn't say, or inflammation, and it doesn't say where the inflammation is coming from. Just something is going on in my
Mhm.
circulatory system. So therefore, he orders an MRI. So I've never had an MRI before. If you've never had an MRI, it's an experience. You go into this tube, it makes all kinds of crazy sounds,
You
and
can't
you're
be
there for,
claustrophobic and have an
oh my
MRI.
God, exactly. And it's 25 minutes. I mean, it's just not like a ride at Disney World. It is a long, long process. So I have this MRI and he calls me the next few days when it comes back. And he calls me on the phone. He says, Al, do you want to come into the office? We can discuss what I see, or do you want to talk on the phone? I said, Billy, what's the big deal? Just tell me what you see. So he first starts off with a little joke and he says, did somebody beat you up or did you fall down the steps? I said, Billy, I just carried my bag on my right shoulder. It got sore. What's going on? Then he gets a little more serious and he says, I see a vertebral compression fracture. Several ribs are fractured. You have a hairline crack in your pelvis, and there's a soft tissue mass around 2 to 3 centimeters large on the side of your spine.
Wow.
Then he says, I think you have leukemia, lymphoma, or multiple myeloma.
All very scary words.
He's not giving me any other options. These are all 3 cancers. Now, wait a minute. I am thinking I am the senior poster boy for a healthy lifestyle and primal diet. And you're telling me I have cancer? My life is just falling apart at that moment. So he refers me to a good buddy of his. He's an oncologist. I don't know him yet. And I schedule the appointment, of course, and I have a host of other tests done. And I go to his office. And my wife is there and my 2 adult children. And George, who is still my oncologist, and he's a conventional oncologist, looks at me after he goes over all the reports, the PET scan and tissue biopsies and whatever. And he says, you have IgA kappa light chain multiple myeloma with innumerable lytic lesions throughout your spine, meaning I have holes in my entire skeleton, which would be typical of a person that had severe osteoporosis.
Oh my goodness.
That's why I had broken bones, and that's why I had pain. And the reason I couldn't breathe was the broken rib was pushing into my lungs. So, and then he says, this disease is incurable. And he gives me 3 to 6 months to live. So
Before we keep going,
yeah.
what does that do to you?
Oh my God.
What kind of emotions do you go through? So before you reach that determination phase, what is it like being faced with your own mortality?
Yes.
What kind of emotion, what does that do to your psyche in moving forward?
This is a great question, and I want to go into it in much detail as you want. And I write about it constantly. I actually started writing about it when I was diagnosed in September 2018. So the diagnosis is in 2018. That's the prognosis. I was expected to die by December 2018. So what goes on in my mind? First of all, a ton of bricks drops, and I realized the life I have lived for 71 years is over. Now, it doesn't mean I'm dead, but my life is over. My practice is over. I can't go back to practice. I can't do the things I was doing. Now my bones are so fragile, I can break them at any moment, at any time. So, and the disease is incurable. Now, I have a philosophy. I had this philosophy all my life, certainly all my adult life, and that was, if I ever had a need for chemotherapy, I would reject it because of the potential side effects and the destructive nature of chemotherapy. And my thought process is, why destroy my body with outside chemicals when I need to enhance my immune system? So I never thought I would ever go through chemotherapy. And my other thought, which was even more important, was quality of life is everything. So if I am healthy, although I couldn't breathe well at that moment, if I can be healthy and feel good without chemotherapy, but only live another several months, several years, I'm okay with that. I don't want to extend my life with chemicals that are going to debilitate me over a period of time, and I'll get sicker and sicker and sicker. I'm just alive. That doesn't compute with me. So
And I
longevity
feel
meant
like
nothing.
that's a decision that people who get this diagnosis or any kind of terminal cancer diagnosis have to face. I think that's probably something that goes through everybody's minds, and it's brave no matter what decision you make, what direction you choose to go. And it's really interesting that you already had that at your core and in your psyche that this is the way you were going to go. So is that the route you chose?
So this is how it kind of played out. my wife and I had already spoken about this subject several times, even before my cancer diagnosis.
Mhm.
And she is not in agreement with me if that were her case,
Yeah,
but she certainly was on my page because I'm making the decision.
sure.
So I'm looking at her while George, my oncologist, is telling me what's going on. And she kind of, I see in her eyes, she knows what I'm going to say.
Yeah.
Because George then says, tomorrow you're going to start chemotherapy and we'll also start radiation treatment so that we can take care of the pain in your chest. The radiation will not treat your cancer, but it will relieve the pain so you can breathe correctly. And
Mhm.
then the chemotherapy will just get started with, and it'll be a whole round of infusion of drugs. And I said, well, wait a minute. Why would I do chemotherapy if this disease is incurable? So he says, we're having a great conversation, by the way. I'm blown away and devastated, but it's a great conversation. So he says, when you have chemotherapy, you will actually go into remission. And if you go into remission, you're going to feel great and you'll be fine. And then, unfortunately, the disease will come back. And once it comes back, we will not be able to use the same chemotherapy drugs because they won't be effective anymore. So we'll have to use more caustic drugs to get you back into remission. I said, well, you said this disease is incurable. So what's going to happen? I'm kind of geeky and I want to know how I'm going to die now.
Mhm.
So he says, what's going to happen is this. We will use chemotherapy. You're not a good candidate for stem cell therapy. And once the chemotherapy doesn't work, your body will start to break down and you will die from one of generally three processes. Either you'll bleed to death internally because your blood cells are going to be so overpopulated with the malignancy that you'll have severe anemia and bleed, or you will have kidney failure and you'll die from kidney failure, or you'll develop an infection that normally would be treatable, but because your immune system is so compromised, no antibiotics will cut it and you'll die from an infection. This is the way
Mhm.
most people with multiple myeloma die. All right.
So it would just be prolonging the
And the
inevitable.
inevitable, but
Mhm.
not prolonging it like you go on a horizontal path and then drop dead.
Yeah.
You are now decreasing your quality of life to the point that you're so debilitated and then you die. This is not the way I prefer to live. I'm not telling anybody to do this. This is not the way I prefer to live.
Sure, sure. And
So
I
I
think
am,
we are all entitled to that choice.
yeah.
Yeah.
So my choice was thank you, but no thank you. I'm not doing chemotherapy. I reject chemotherapy. I'll do the radiation because I can't breathe. And this is
Mm.
very unpleasant and actually painful. So I do the radiation, everything is fine. I do not do chemo. So I tell George, I said, look, I need to do some real severe research right now and find out what other alternative methods that I can create and see that's being done that will support my immune system. I don't want to destroy it with chemotherapy. I want to rebuild my immune system. If I can rebuild my immune system, then basically I have everything working for me to heal my body. If it can't heal, it can't heal. And I'm going to die like everybody's going to die eventually.
Yeah.
And I'm okay with that. And you mentioned something about mortality, and I want to bring this up to you with you. And I know that this is going to be very controversial, but this is my belief. I am not religious at all. I do not subscribe to a religion, but I am amazingly spiritual. I believe in my spirit. I believe, and this is going to be the controversial part, I believe that we are here more than one time. I believe in reincarnation. I believe that my soul has put itself in this body, in this incarnation for a purpose. I had no idea what the purpose was. I'm thinking this is the purpose now. And that is, I'm going to do what I can do to restore my body's health and immune system and get it out to the world. And then I'll die. And I have no problem with that. And I believe that this is the lesson I'm supposed to learn this time around.
Mhm.
And I believe also I'll have another time and another time and another time to learn all kinds of other lessons. And I may be a me like I am now, or a different person, any kind of, good person, a bad person, a male, a female. You reincarnate, is my belief, in any other human form to learn lessons. Now, you don't have to believe this. I believe this, but it is comforting to me. And this is what has kept me going, because I know that I am more than my mortal body. And this is just a temporary vessel that I am in, and I will come back. But right now, I'm comfortable with this. So this has helped me with some depressing states that maybe others would not be able to get out of. And of course, my wife is a pillar. I mean, she is so strong. She has pulled me up from very deep depression states. But this is what has carried me on. So this is very important for me.
I'm sure it's a roller coaster of emotions, and whatever faith that you have or whatever belief system that you have in the end, whatever comforts you and gets you to be okay with your mortality, I can't judge, and I don't think anybody else can judge. But I want to go backwards a little bit to what you said before, about having this conversation with your oncologist, and kind of how like shocked he was that you were saying, okay, I don't really want to do this. I love the fact that it was a conversation and it was a decision that was made together. Because I think oftentimes we go in, we're like, okay, tell us what to do, tell me what to do, tell me what to do, and we don't really kind of have a role in our own healing and our own treatment, and in kind of injecting our own ideas and how we want to move forward. So I appreciate that, and I wish it happened more often. And so, kudos to you for that. That's awesome. I mean, how's your relationship with him now?
It's amazingly awesome. And I'll
Yeah.
tell you why. I do know other patients that have decided they didn't want to do chemotherapy, and the oncologist literally fired them from the practice,
Wow.
which is really sad.
That
So
is
my
sad.
oncologist is in a big group, and he cannot suggest to anybody, patients wise, uh, to them what I am doing, because he would number one get fired from the group, and he'd
Sure.
lose his license because it's not standard of care. So, but he is so interested in what I do. He reads my blogs all the time, and he asks me to bring reprints of the articles that I have used to support and
Mhm.
create my unconventional cancer protocols. So he's very interested, and he's the only oncologist I've ever seen. I see him every 4 weeks. We work together, and I just saw him this past Tuesday. He even jokes around. He says, "Look, I need to see some sick people. Let me go." Because we start to talk, and we just talk and
Sure.
talk, and he has these dying patients that he needs to see. But it was a great conversation in the beginning, and it's always continued that way, which is awesome.
Which, before we go to what you ended up doing and how you moved forward from this
Mhm.
diagnosis, it's really speaks to the need for me, in my opinion. I've always felt very strongly about this, the need for an integrative approach. Whether it's practitioners on both ends of the spectrum working together for a problem, kind of this one size fits all is obviously not working for these overarching health issues that are plaguing our country, not just our country, but most industrialized countries. It's insanity to me.
It is. It is sad. I think it's the problem with all westernized medicine. Um, we are so specialized. If you went to a gastroenterologist, he has no idea of an eye problem that you might have. Or if you went to a dermatologist, he has no idea of a gut problem you have, or um, a diet problem that you have. They don't understand the integration. Every cell in our body literally talks to every other cell. It does that in one of two ways, maybe even more. It creates chemical elements that it passes through the bloodstream, called cytokines, and a whole
Mhm.
other series of elements that communicate. And they also communicate by frequency. They have a living frequency. We are electrical beings. If we didn't understand electricity and we stopped all of our electricity in our body, we would die. Our heart pumps because of electricity. Our cells have energy because they produce electricity from a battery called the mitochondria that produces the power called ATP. So all of these create a frequency and the cells communicate. Even our microbiome, which are 38 trillion microbes, and we only have 30 trillion human cells, so we're more microbial than human. Our immune system understands the healthy microbes in our gut because they communicate by frequency. If the microbes have a frequency that the immune system doesn't recognize as its own, it will destroy it. So it's very, very important. Um, so I don't know
Vital,
where
I
I
would
was going
say
with
to,
that,
yeah,
but
vital, I would say to moving forward and getting back to true health, I would
yeah.
say, and being able to treat somebody as, a whole person instead of these individual systems.
So
Um,
we need that, and our system is
Absolutely.
starting to slowly get there, but it's
Yes.
not conventional.
Yeah.
And insurance
Or
companies,
popular.
unfortunately, yeah. So insurance companies don't recognize this, although they're
Yeah.
getting a little bit better at it. And because of that, the medical schools are not teaching integrative medicine like that.
Yeah.
And certainly dentists who should be have a platform where they are so um, active in the vision of what's going on in the mouth, and the mouth is a mirror to everything else in the body. They should be integrated in all of medicine, and they're not. And
Yeah.
most dentists are ignorant to that fact anyhow. They just don't understand what they see.
Which we're going to do a part 2 on. I'm going to have you back on and we're going to dive into all things
Dental.
dental, and yeah, absolutely. But so
Cool.
let's go ahead and move forward.
Yeah.
Where did you go from this diagnosis, and kind of after the emotional roller coaster of it all, what happened?
So what I started to do was investigate and research other forms of treatment for cancers. And there's so much out there, and there's a
Yeah,
lot of junk, in my opinion.
sure.
And then there's a lot of expensive stuff that may or may not have been proven. That's certainly not covered by insurance. So you have to do a lot of research. My research was primarily through PubMed,
Hmm.
pubmed.gov, which is basically um, a receptacle area of all kinds of medical papers from all over the world
Right.
for years and years and years. If you want to find anything out medically, you can go to pubmed.gov, type in the word or phrase that you're interested in, and thousands of abstract medical papers will pop up, and you can read what's being done all over the
Yeah.
world. And what I wanted to see was what was being done for multiple myeloma in an alternative type of style that was being duplicated. I didn't want one guy doing one thing and no one else could duplicate it.
Yeah,
I
right.
want to find out that other people were doing some similar things that were being maybe effective. So what I discovered, and I've tweaked my protocols constantly, but where I am right now is I discovered diet is critical, and I'll explain where we are with that or where I am with it now. I really understood the gut microbiome is absolutely critical because it tells the body so much to do because it communicates with the immune system. So having a robust immune system is also critical. Another critical element is the cellular structure of every cell in my body, the membrane, the production of energy through the mitochondria is critical. So I learned about these different areas, integrated that with all the other normal things like efficient exercise, stress reduction, restorative sleep, um, uh, uh, a variety of things to um, stretching exercises, a variety of things to make my body overall healthy, but very specifically my immune system.
Hmm.
So I started on a paleo diet, as you know, from the
Yeah.
age of 66 to 71. When I was diagnosed, I switched from a paleo diet to a paleo autoimmune diet.
Right.
Basically, removed some of these foods that could be irritating, like nightshades and those types of things, creating an autoimmune response. And I did that for up until January 1st, 2020. Then I found some more research, especially from a clinic in Budapest, Hungary, called the Paleomedicina Clinic. Now, this is a fascinating place. It's been in existence for about 10 years or so. The doctors in the clinic are treating humans, not rats or mice, and they have treated about 5,000 patients to date. They only treat severe chronic disease and cancer, and they treat curable cancer as well as incurable cancer. And they treat them primarily with a diet, which they call the Paleolithic ketogenic diet, and no prescription medications and no supplements. Now,
Wow.
the animal-based diet, like a carnivore diet, but they call
Mhm.
it the Paleolithic ketogenic diet, it's very strict. It is a fat to protein ratio measured in grams of 2 to 1. So it's a high fat, moderate protein, relatively low to zero carb diet.
Which is crazy because it sounds so counterintuitive to what we would
Well,
consider.
yeah, certainly if you're in the vegan world, it would be totally counterintuitive.
Sure.
And so the results are very interesting because they publish their clinical reports in various medical journals, translated into English, and they are compelling if you're doing some reading and research. So
Yeah.
I'm targeting the cancer research, although they have lots of articles about other chronic diseases. I'm looking for their cancer patients, and I'm seeing some phenomenal results. The most recent result that I've read was maybe published 6 or 8 months ago. And I'll just tell you the story because it is pretty impressive.
Yeah.
There was a 52-year-old man who had glioblastomas. That's a brain cancer that is basically terminal. People that
Right.
develop glioblastoma are dead in a few months, generally.
Yeah.
So he had this glioblastoma. He saw a conventional oncologist. He had radiation, surgery, and chemotherapy done. And he
Mm.
went into remission for 2 months. Then he came back full blown. And his oncologist, conventional oncologist, wanted him to go through the same treatment. He refused. And he went to the Paleomedicina Clinic. And this is in the report. I don't know this guy. I just read the report.
Mhm.
So Paleomedicina Clinic put him on the Paleolithic ketogenic diet, animal-based diet, 100% animal-based, and that means animal meat, fat, organs, and the collagen materials. And no prescription drugs and no supplements. They reported his case after 38 months of his success. Now, he did not go into remission, but the lesion in his brain did not grow anymore. His symptoms subsided and he was symptom free and was living a relatively normal life with glioblastoma.
Wow.
So that is a very interesting story. And they have many other cancer stories with remission and cures. But this was very impressive because it was glioblastoma. So then I started to think, and I researched the carnivore diet and the animal-based diet and the medical reasons why it would be beneficial. And I went on a carnivore diet as of January 1st, 2020, and that's what I am on now. Now, I do 80% to 90% animal-based, and I do maybe 10%, maybe 15% plant-based, but my plants are low in phytates, oxalates, and lectins. These are anti-nutrients that damage the gut. So I will eat on my plate of food. If you look at a plate of food and you're just looking at the volume,
Mhm.
I would have maybe 80 to 90% animal-based foods. That includes the fat and all that other stuff I told you.
Yeah.
And then maybe some blueberries or an apple if I want to have that at the time. Very, very few other vegetables because they are high in oxalates and lectins, but the most of the fruits are low in those things. So I will have some of that. And I will do that for 6 days out of a week. So I will stay in what's called ketosis. I know I'm in ketosis because I use a breath ketone meter, and I know I have staying in ketosis, which means I'm not feeding glucose to my cancer cells,
Hmm.
and I am supporting my body's ability to improve my mitochondria. I'm improving my endogenous, my body's self-made antioxidants like glutathione. And ketones are just a phenomenal clean burning fuel for the body. But once a week, I cycle out of ketosis to become what's called metabolically flexible and allow my body to digest the carbs that I want to eat. And I'll eat maybe 150 grams of carbs or so for that day. That's a lot of carbs for
Yeah.
me. And I'll get those carbs from a variety of all kinds of fruits as well as raw honey. And I eat several tablespoons of raw honey. Raw honey has about 17 grams of carbs per tablespoon, and it's phenomenally healthy food. And by the way, it's animal based. Bees are animals.
Right.
So
Right.
it's very interesting. Um, so I do this cycle in and out of ketosis, and I have this metabolic flexibility where I am really improving my entire digestion. So that helps my body to heal itself. Now, it improves my gut microbiome also, but I enhance my gut microbiome with spore-based probiotics. Now, spore-based probiotics are different than most probiotics that are out there, and they're different from soil-based probiotics. Spore-based probiotics are basically bacillus type of bacteria that have an encapsulation, which is a spore, and it sits dormant in the soil. Animals like cattle defecate. They have spores that they defecate. They
Hmm.
stay in the soil, gets on the food products. That's how it recycles. Well, today, it used to be we ate spores all the time, but now we don't, the way we eat food. So these spores I get and get into my system, they are resistant to the stomach acid, and they will get through the stomach acid, get into the intestines, and duplicate or replicate, germinate themselves.
Hmm.
They also make a whole bunch of chemical metabolites that are beneficial for the rest of the gut microbiome. But tests have shown that in humans that these spores will improve your commensal, your friendly bacteria in the gut, in number and quality and quantity, which is what I need. So other probiotics like lactobacillus species and um, bifidobacteria species, which are very good, produce all kinds of great metabolites that go through the stomach acid. Those bacteria are killed in the stomach acid. So
Right.
they cannot regerminate in the gut, but their metabolites are beneficial. They're good, but spores are much better. So I use the spore-based probiotics.
So where do you stand now?
Well,
How
let me,
has what results did you see from this? Because obviously you're still here
oh
and you're
yeah,
still on this
oh
diet.
yeah, oh
Obviously
yeah.
you were seeing some sort of
Phenomenal
results.
results. So let me tell you, I check my ketone level. So I know I'm in ketosis.
Yeah.
That's a great thing. I check my glycemic variability. In other words, my ability for my insulin to get rid of glucose in my blood efficiently and effectively. So I have done a continuous glucose monitor. It's a little gadget that you attach to your underarm,
Mhm.
part of your underarm, and it will read your glucose levels 24 hours a day, 7 days a week for 2 weeks. And you know how efficiently you're moving glucose back and forth. And that variability is critical because if you have a low standard deviation of this glycemic or glucose variability, it indicates, and there are plenty of studies to prove that it indicates a very good resistance to other chronic diseases, including cancer, and it indicates a very healthy, robust immune system.
Yeah.
That's what my goal is. I've also done a stool type test, which is relatively new, that will identify my alpha diversity. Alpha diversity is the diversity or the variety of species of bacteria in your gut. All the studies of primal societies today, like the Hadza in Tanzania, when they've done medical research, have done gut microbe testing of these people, they have many, 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 many species of bacteria, huge numbers of
Yeah.
species. and they don't have chronic disease. They don't have gum disease or tooth decay and all kinds of stuff. We'll get into that in part two. But what is prevalent is this phenomenal diversity, and it is called alpha diversity. So when I had my alpha diversity check, now I've been on this diet and on these probiotics and everything, which I still do, I was placed in the 98th percentile. Now, mind you, I have terminal cancer.
Right.
My immune system should be shot. If I came into contact with somebody with a cold, I could get pneumonia and die,
Yeah.
theoretically. And my alpha diversity is in the 98th percentile of healthy people, meaning that 98% of healthy people have less diversity in their gut than I do. That's pretty impressive. And that's from what I've been doing.
Yeah.
So, and then vitamin D is very, very critical. I do maintain a very high vitamin D blood level, 25 hydroxy vitamin D level. Mine is in the range of 80 nanograms per milliliter right now. I'm doing an individual test. I'll just tell you about it. I'm doing an individual test. I do not want to suggest anybody to try this, but there's some research that suggests it might be beneficial to me. I am taking an enormous amount of vitamin D and K2. Actually, I'm taking 20,000 international units of vitamin D3 a day and 320 micrograms of vitamin K2 a day. I just had my blood tested. I was doing this for 30 days. Just had my blood tested 2 days ago. My calcium is in normal range, so it's no problem. Everything is in normal range. And some of the research I have read, some of it's anecdotal, some of it's published research, suggests that it may decrease my dysfunctional antibodies, my IgA antibodies, which is my cancer. We'll see if it happens. That's being tested right now. I'll give you an update when we do part two.
Yeah.
But it will be interesting. There's so much research about vitamin D3 anyhow right now, especially with COVID.
Right.
And I'm very excited about being in that range where I am now, but I probably will go higher with this dosage, maybe up to 100 to 120 nanograms per milliliter. It's high. We'll see what it does. It's my test for my body.
Sure. And again, we're not telling anybody to do
No.
anything. This is you using your tools to,
Right. I'm not ever going to recommend, and I do not have a cure for cancer. My protocols are only designed to improve my immune system, which anybody could do.
So where does your cancer stand now?
Yes. So let me tell you this story. So I have to backtrack because this is an exciting part. September 2018, I was diagnosed, rejected chemotherapy, went on my protocols, different protocols then than I'm on now. For another year, I did really well. Didn't get better, didn't get worse, did really well. Had a couple broken bones along the way, had to deal with that, but I was doing well. So let's fast forward to August of 2019. August 2019, I'm standing in my bathroom, brushing and flossing my teeth, and I twist to throw some dental floss away. When I twist, I break my right femur in half, crash to the floor, break 2 ribs, and my right humerus I fracture in half. I'm writhing on the floor with pain. And finally, my wife comes in, we get an ambulance, takes me to the hospital. I believe my life is over. I've lived over a year after my prognosis. And they fix my leg because I would have bled to death from the femoral artery. They don't fix my arm. I reject everything, and they put me in hospice hospital to die. So I'm in a hospice hospital to die. A variety of things occurs. Eventually, I get home with hospice, and my wife kind of knocks me in the head psychologically and says, look, you're not a victim, you're a survivor. We'll get a physical therapist in, we'll get working with you. And actually, I rally. And I revoke hospice, get back to my oncologist, and he's amazed that I'm still alive. And then in May 2020, he wants to have another PET scan done to see where my cancer is. And we have this PET scan done. And he calls me the next day and he says, make sure your wife is on speakerphone. And he reads the radiology report and it says, no active cancer cell visible in any of your body, any parts of your body.
Wow.
Now, PET scans only show moderate to severe cancer. I am not in remission. I still have dysfunctional antibodies,
Yeah.
probably malignant plasma cells. But right now, I feel great. I do well. Um, I walk about a mile every day. I do some exercises inside the house that are kind of modified. I am doing quite well.
That is
It's a
amazing
great,
to hear.
it's
It
a
is
great, it's a
a
great story, and I
feel
feel
good
so good.
story because you can kind of weave in a whole bunch of different things here, kind of making that choice that you did to handle the diagnosis the way that you did in your own way, and kind of saying no to some of these things, being that it was the end of your life, you making these choices, and then kind of coming to terms with your own mortality and everything that comes with that, and then being where you are now and kind of working with people in the same positions. It's amazing to me.
I will tell you, and I know we're going to end soon, but I
Yeah.
will tell you, people may be in a life-threatening situation or know people that are in a life-threatening situation, generally some kind of medical issue.
Yeah.
I will tell you that do not necessarily take everything that that one person with a white coat says to you. Explain to that person you want to do a little research. Go and do independent research, get
Yeah.
other opinions. If your oncologist or medical professional says you do what I say or else, I would fire that person. There are plenty of other quality people out there
Yeah.
to look for. Um, and have the right attitude, have the right support staff. My wife was my pillar and still is. You need to have someone that is there that you can communicate with, but do yourself a favor and realize, even if it is a terrible diagnosis, there are other ways that you can go to support your body's healing. And if nothing else, if you improve your immune system, which I know you can do with the methods that I use, if you support your immune system, you will create the best method to heal your body as possible. We're all
Mhm.
going to die. Just,
Sure.
get over that. Just want you just want to have the rest of your years to be as high quality as you can.
Right. No matter how many those are. Yeah. I think
Absolutely.
that's a fabulous point. And we often forget that we have choices. So I'm glad that you
We
brought
do.
that up. Yeah.
Please, we do have
Yes.
choices.
Well, thank you so much for sharing your story and all
Thank you,
of your
Brandy, for the
knowledge.
opportunity.
Yeah, and we'll bring you on for part 2, and we'll dive into kind of the
Absolutely. I love that.
periodontist and kind of the mouth gut um, pathways and all that fun stuff. So, yeah, we'll look forward to that really soon.
Thank you. Thanks for the opportunity, Brandy.
Thank you.